liver cancer is the sixth most commonly diagnosed cancer worldwide and third leading cause of cancer-related deaths in the United States. HCC is the most common type of liver cancer, yet more than half of patients are diagnosed at advanced stages of the disease, often when symptoms first begin to appear. Now, historically, the prognosis for advanced HCC has been poor, with only 7% of patients surviving up to 5 years. Today, I have Dr. Shore with the University of Arizona Cancer Center. Good morning, doctor. How are you?
Good morning. I'm doing great. Thank you.
Could you tell us about liver cancer?
Yeah, liver cancer, as you alluded to, is a growing problem globally. It's the sixth most common cause of cancer and a leading cause of cancer death worldwide. And, more concerning is that it is one of the fastest rising in incidence. And like you mentioned, unfortunately, because there's not a lot of specific symptoms, about 70% of patients by the time they're diagnosed have what we call advanced liver cancer or hepatocellular carcinoma, which is the most common form. And that means that they can't undergo a surgical operation to cure them of the disease.
Now, who's impacted by liver cancer?
Well, we expect about 41,000 people to be diagnosed this year with liver cancer, which is why I'm so happy to partner with AstraZeneca to raise awareness in this space. But probably the biggest risk factor for developing liver cancer is having underlying cirrhosis of the liver or kind of chronic inflammation of the liver. And that can come from a lot of different things. It can come from lifestyle related choices that lead to metabolic syndrome and fatty liver disease. It can come from excessive alcohol use, hepatitis infections. But we know that that chronic inflammation and cirrhosis can then progress to developing liver cancer.
Okay, how are patients with UHCC treated, and what is UHCC?
Yes, so UHCC means unresectable hepatocellular carcinoma, but basically an advanced liver cancer that cannot be operated on. And I will say it's a really exciting time in this space because we've made great progress in terms of treatment options, with immunotherapy being a real viable one for patients. And that's the idea of training your body's own immune system to activate and kill and hunt out cancer cells. And so in 2022, we had an FDA approval of an immunotherapy combination with Imfinzi and Imjudo. And that was based on a large phase 3 trial called the Himalaya trial. And in this trial, what we found is that with the combination immunotherapy approach, we were able to reduce the risk of death from liver cancer by 22%. And in fact, earlier this year in September, we saw longer term follow-up data from this. And what was really exciting is 20% of patients were still alive at 5 years when they were treated with this immunotherapy combination, compared to only 9% in people who got standard treatments. And I think equally important, all treatment for cancer and medications have risks and potential side effects, as does immunotherapy. So if you develop any of those symptoms, it's important to talk with your doctor so we can manage it. But in general, this was a really well-tolerated treatment option for patients.
Now, what does this data mean for patients?
And I think the main thing that it does is it gives us hope that we're making progress. Patients are living so much longer now with advanced liver cancer with these treatment options. And importantly, they have good quality of life. So they're able to live longer and live better. And I think that's a really important beacon of hope for patients.
Now, what advice would you give to patients with UHCC and their loved ones, and where would you direct them to find out more information?
I think the most important piece of advice is that, to be an active advocate and to talk with your doctor if you develop any sort of new signs, symptoms, or things that need to be managed. But also, there's a lot of really great online resources for learning about liver cancer, such as imfinzi.com, imfinzi.com, where you can learn more about liver cancer, how it's diagnosed, what the treatment options are, and that's a way to really inform and empower yourself.
You know what's very interesting, doctor, is it seems like medicine is getting to the point where it's really helping our immune system to fight most diseases. Talk about that just a little bit.
Yeah, I mean, it's immunotherapy and that idea of letting your body's own immune system recognize cancer cells as foreign. I mean, it's why it led to the Nobel Prize. I mean, it has absolutely changed the landscape for treating cancer. It's taken diseases that when I first started, people were dying from and cured them of those diseases. Liver cancer is a perfect example of we just had such minimal treatment options for patients until we were able to find these combination immunotherapy options for them. So it is so wonderful to be able to use your body's own immune system to kill cancer, as opposed to things like chemotherapy, which is a very different approach.
I've been speaking with Dr. Rachna Shroff, MD, is Associate Director of Clinical Investigations and co-leader of the Gastrointestinal Clinic Research Team at the University of Arizona Cancer Center. And I hope she doesn't get too upset with me, but that was a very interesting game between Colorado and Arizona last week. So
You had to bring that up, didn't you?
Doctor, thank you so much for joining us on Morning Blend.
Thanks so much for having me.